I often get a lot of questions about acne. Now, unfortunately, acne doesn't really have a one-size-fits-all treatment, but I know a lot of you have tried just about every topical skincare product there is. So I think that's where a really good clinical treatment can come in. Now, I have popped back into Candela Medical head office today, as I know Kirsten Keisha is being visited by a beautiful model today who will be undergoing an acne treatment. So we're going to talk you through it.
Acne is a skin disorder that's caused by sluggish dead skin cells, sebum and bacteria. It's aggravated by something called hyperkeratosis, so a buildup of keratin as well. And the clinical evidence is papules, pustules, cysts and nodules, and we call them comedones, closed comedones, open comedones, and some erythema due to the inflammation as well. We are treating a young woman today with a slight case of acne that is stimulated by that premenstrual shift of hormones. You see an increase in sebum, inflammation, and that's due to the swelling of the follicles and the extra activity in the sebaceous gland. I'm using the Nordlys PR530 applicator today to treat this type of acne. The shortwave technology or the narrowband technology means that between 530 and 750, the wavelengths actually target the peaks of hemoglobin. This means that we can reduce the amount of inflammation or those little tiny blood vessels that are feeding the sebaceous activity. At the same time, those same wave bands can target the porphyrins that are created by the bacteria in the sebaceous gland and in the hair follicle as well. And when we target the porphyrins, this creates an antibactericidal effect, and we can reduce the amount of bacteria at the same time.
And is there anyone that you would suggest that this treatment isn't suitable for?
Well, the PR530 is also attracted to melanin. We do treat pigmentation with this applicator as well. So we do recommend that we only treat Fitzpatrick skin types 1 to 3. And we would also recommend that they stay out of the sun 2 weeks prior and 2 weeks after. So nobody with a tan, nobody with fake tan, and anybody that's on photosensitizing medications such as Roaccutane, we wouldn't treat them for a minimum of 6 to 12 months afterwards as well.
And is there anything that we need to know before the treatment? Anything we need to know about getting the skin ready?
Apart from staying out of the sun for 2 weeks prior to the treatment, we do recommend that you use really good skincare. When you have acne and lots of comedones or blackheads, you'll find that the hair follicles are really clogged and congested with dead skin cells. And one ingredient that I find that's really useful is salicylic acid. It does break down the keratin plugs. It's really good at smoothing out the surface of the skin and reducing oil flow that way as well. So that's a really good ingredient. You will need to wear a sunscreen with that. Hyaluronic acid is really good. It's really light, it's really hydrating. Keeping your skin really clean is very important as well.
And is there any downtime involved with this treatment?
Well, apart from just some transient erythema post-treatment that probably takes 1 to 2 hours to subside, there is no downtime at all. It's a really easy treatment. You can include it in any of your facial treatments in your clinic, and it's very quick, it's easy, hardly any pain, and people can go back to work straight away.
Okay, so 3, 2, 1. How was that?
Just a little warmer.
Just a little bit warm?
Yeah.
Fantastic. 3, 2, 1. too bad? Excellent. I've lowered the energy by a whole joule because my model here is a Fitzpatrick Skin Type 3 and I am using the PR 530 to 750. So with the Fitz 3 we do need to be careful because we know that this narrow band of light is attracted to melanin as well. And so therefore I don't want to treat her pigmentation, she doesn't have any. So I've lowered the energy by a joule because I'm going to do a second pass on the sub-millisecond pulse duration, again on very low settings. And the endpoint that you're looking at is just a slight erythema. And that's all she'll have. So it makes it an ideal treatment to do all the time. It's so easy and so quick, you can incorporate it into any kind of facial treatment. Turning it down again for the forehead because it's bony and the light does reflect off the bone and it's more painful. Okay, so I'm just going to do a few little pulses across the forehead. Okay. I'm up to my second pass now and as you can see the erythema has almost disappeared already, and with my second pass I'm going to use the rosacea settings on the Nordlys. As you can see you've got really low energy, you've got an extremely short pulse duration of 1.5 milliseconds. If I want to I can go into expert mode and I can even shorten that further as well. So this is also the beauty of narrowband technology. We can use lower energy and we can use a sub-millisecond pulse duration that can target the background redness. Okay, by your chin or by your lip. By your lip. I don't know how you would bite your chin, might be a bit difficult. Finishing off with the sub-millisecond pulse duration on the forehead. 3, 2, 1.
So we're all done. How many treatments would you recommend before we start seeing results?
Look, I recommend with this particular treatment that you get them to come in when their skin's at the worst. So that's going to be, you know, probably just after their menstrual cycle because the acne does erupt around that time. And so you're looking at one treatment a month, and I do think that 3 or 4 treatments will really show you some lovely results.
And finally, what does a good aftercare routine look like?
Well, as I said before, just some light hydrating ingredients, nothing that is going to clog the pores or increase sebaceous activity, so nothing with oil in it, and something light, something that is going to, or cleanses, that it will keep the pores clean, and of course, sunscreen every day.